You think it's healing, but it might be getting worse. This is one of the most dangerous misconceptions I encounter in my practice. Patients come in thinking their diabetic foot ulcer is improving, when in reality, it's progressing towards a serious complication that could threaten their limb or even their life. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas, with over 25 years of experience treating diabetic patients. In today's module, we're going to focus on something equally critical: recognizing when an ulcer is getting worse and needs immediate professional attention. Before we dive in, I want to remind you about my comprehensive book on diabetic foot ulcers. You can get it completely free at www.footulcerbook.com. This book contains detailed information that could help save your foot or the foot of someone you care about. Please take a moment to like this video, hit the subscribe button, and share it on social media. The information we're covering today could prevent someone from losing a limb. Here's the reality. Visual appearance alone can be incredibly misleading when it comes to diabetic foot ulcers. What looks like healing on the surface might actually be masking serious problems underneath. Many patients focus only on whether their ulcer appears smaller or whether there's less drainage, but the surface changes don't tell the whole story. I've had patients come into my office proud to show me their ulcer, that it looks better, only to discover during examination that the infection has actually spread deeper in the tissue or even reached the bone. The surface might appear to be closing, but underneath the wound could be tunneling deeper or developing pockets of infection. This happens because diabetic patients often have compromised immune systems that don't mount the typical inflammatory response we expect to see with infection. Additionally, the poor circulation that often accompanies diabetes means the usual signs of infection, like significant redness, warmth, and swelling, might be diminished or absent entirely. Another reason patients misjudge their progress is that they're comparing their ulcer to regular cuts or wounds they've had in the past. But diabetic foot ulcers follow completely different healing patterns and timelines. What might seem like normal healing for a regular wound could actually indicate a problem in a diabetic foot ulcer. Many patients also don't realize that diabetic foot ulcers can appear to improve temporarily before getting worse. This happens when the surface skin begins to close over an infection that's still present in the deeper tissues. The ulcer might look smaller or seem to be healing, but the underlying infection continues to spread. Understanding the stages of wound progression is crucial for recognizing when your ulcer is getting worse rather than better. Diabetic foot ulcers typically progress through 5 distinct stages, and knowing what to look for at each stage can help you identify problems early. Stage 1 begins with redness or a blister. This might seem minor, but in diabetic patients, even this early stage requires attention. The redness indicates inflammation, which could be the beginning of tissue breakdown. A blister, especially in the area of pressure or friction, can quickly progress to an open wound. At this stage, the key is to remove pressure from the area and monitor closely for changes. Stage 2 involves actual skin breakdown. The outer layer of the skin is damaged, creating a shallow wound. This might look like a scrape or abrasion, but in diabetic patients, it represents a significant breach in the body's protective barrier. At this stage, proper wound care and pressure relief are essential to prevent progression. Stage 3 is when you have an open sore with drainage. The wound now extends through the full thickness of the skin and might involve the underlying fat layer. Drainage in this stage is common and isn't necessarily a bad sign. It can actually help clear bacteria and debris from the wound. However, the type, amount, and odor of the drainage are important indicators of whether the wound is healing or getting worse. Stage 4 involves deep tissue involvement. The tissue now extends into the muscle, tendon, or other deep structures. This is a serious stage that requires aggressive treatment. The wound may appear deceptively small on the surface while extending deeply into the foot. This is why professional assessment is so important. What you can see on the surface doesn't reflect the true extent of the problem. Stage 5 is the most serious: infection and bone involvement. When bacteria reach the bone, it creates osteomyelitis, a condition that's difficult to treat and may require surgical intervention. At this stage, the risk of amputation increases significantly. The critical thing to understand is that these stages don't always progress in a linear fashion. An ulcer can jump from stage 2 to stage 4 quickly, especially if there's an underlying infection or if pressure isn't adequately relieved from the area. Now let's talk about the red flags that indicate your ulcer needs immediate medical attention. These are the warning signs that should prompt you to contact your podiatrist or seek emergency care right away. Odor is one of the most significant warning signs. A foul smell coming from your ulcer almost always indicates bacterial infection. The odor might be sweet, musty, or putrid, and it often gets worse over time. If you notice any unusual smell coming from your wound, don't wait. Seek medical attention immediately. Swelling around the ulcer is another serious warning sign. While some mild swelling can be normal in the early stages of wound healing, increased swelling or swelling that extends beyond the immediate area of the ulcer suggests that infection might be spreading to surrounding tissues. Redness around the ulcer, particularly if it's spreading outward from the wound, indicates cellulitis, a spreading skin infection. You might notice red streaking extending up your foot or leg from the ulcer site. This is a medical emergency and requires immediate antibiotic treatment. Drainage that soaks through socks or dressings is concerning, especially if the drainage has changed in character. While some drainage is normal in healing wounds, excessive drainage or drainage that becomes thicker, more colorful, or foul-smelling indicates infection. Fever or chills in conjunction with a foot ulcer suggest the infection might be becoming systemic, spreading throughout your body via your bloodstream. This is a serious complication that requires immediate medical attention and often hospitalization for intravenous antibiotics. Black or discolored tissue in the ulcer is a sign of tissue death or gangrene. This dead tissue provides a breeding ground for bacteria and will not heal on its own. It requires professional debridement, which is surgical removal of the dead tissue. Increased pain around the ulcer might seem contradictory, given that diabetic patients often have neuropathy and reduced sensation. However, if you do have some remaining sensation and notice increased pain, that could indicate spreading infection or tissue damage. The ulcer getting larger rather than smaller over time is an obvious but important warning sign. Healing ulcers should gradually decrease in size. If your ulcer is staying the same size or getting larger despite the treatment, it indicates that your current treatment isn't working and more aggressive treatment is needed. When you see a podiatrist for ulcer evaluation, we conduct a comprehensive assessment that goes far beyond what you can observe at home. Understanding what we look for can help you better monitor your own wound and communicate effectively with your healthcare provider. First, we measure the ulcer's dimensions, length, width, and depth. We track these measurements over time to objectively assess whether the wound is healing, staying the same, or getting worse. We also examine the shape of the ulcer and whether it has any tunneling or undermining, areas where the wound extends under the surrounding skin. We assess the type of tissue in the wound bed. Healthy granulation tissue appears red and slightly bumpy, indicating good blood flow and healing. Yellow or gray tissue may indicate infection or poor circulation. Black tissue indicates tissue death that needs to be removed. The edges of the ulcer tells us a lot about healing potential. Healthy wound edges should be pink and slightly raised, indicating active healing. Rolled or thickened edges might indicate the wound has become chronic and might need special treatment to stimulate healing. We evaluate drainage carefully, not just the amount, but the color, consistency, and odor. Clear or slightly bloody drainage is often normal. Thick, colored, or foul-smelling drainage indicates infection. We check for signs of infection both locally around the wound and systemically throughout your body. This includes checking your temperature, examining lymph nodes, and looking for red streaking or excessive swelling. We also assess the surrounding skin for signs of breakdown, excessive dryness, or other problems that might affect healing or lead to additional ulcers. Sometimes we need additional tests to fully assess your ulcer. X-rays can help us determine if there's any bone involvement or if there's a foreign object in the wound. More advanced imaging like MRI or bone scans might be needed if we suspect a deep infection. Blood tests can help us assess your overall health, check for signs of systemic infection, and evaluate how well your diabetes is controlled. Poor blood sugar control significantly impairs wound healing. Wound cultures help us identify specific bacteria causing infection and determines which antibiotics will be the most effective. We might take cultures from the wound surface or in some cases from deeper tissue. The role of vascular health in wound healing cannot be overstated. Poor circulation is one of the primary reasons diabetic foot ulcers develop and fail to heal. If your circulation isn't adequate, even the best wound care won't be successful. We often perform circulation tests like the ankle brachial index, which compares the blood pressure in your ankle to the blood pressure in your arm. This simple, non-invasive test can detect circulation problems that might not be otherwise obvious. Doppler ultrasound can assess blood flow in the arteries supplying your feet. This test uses sound waves to measure how well blood is flowing through your vessels. If we find significant circulation problems, we'll refer you to a vascular specialist who can perform more detailed studies and potentially improve blood flow through procedures like angioplasty or bypass surgery. Sometimes improving circulation is the key to getting a stubborn ulcer to heal. It's important to understand that wound healing in diabetic patients follows a different timeline than in healthy individuals. A small cut that might heal in a few days in a healthy person can take weeks or months to heal in someone with diabetes. However, there should still be measurable progress over time. Generally, we expect to see some improvement in diabetic foot ulcer within 2 to 4 weeks of appropriate treatment. If there's no improvement or the ulcer is getting worse during this time, it indicates that the current treatment approach isn't working and needs to be changed. The size of the ulcer should gradually decrease over time, the drainage should become clearer, and the tissue in the wound bed should become healthier looking, the surrounding skin should show less redness and swelling. If you're not seeing these positive changes, or you're seeing any of the warning signs we discussed, don't wait. Contact your podiatrist immediately. Early intervention can often prevent minor problems from becoming major complications. One of the most important things to remember is that diabetic foot ulcers are dynamic. They can change quickly, sometimes within hours or days. What looks stable today can become seriously infected tomorrow. This is why regular professional monitoring is so important, and why you need to be vigilant about daily inspection and immediate reporting of any changes. I want to emphasize that if you're seeing any of the warning signs we discussed today, odor, increasing drainage, spreading redness, fever, or black tissue, you need to act now. Don't wait until your next scheduled appointment. Don't try to treat it yourself. Contact your podiatrist immediately or seek emergency care. These warning signs indicate that your ulcer might be progressing towards serious complications that can threaten your limb. Early intervention can often prevent these complications, but delay can lead to hospitalization, prolonged treatment, or even amputation. I'd love to hear from you in the comments. What changes have you seen in your ulcer that concern you? Your questions and experience can help other viewers understand what to watch for. If you found this information helpful, please share this video on social media. Your simple share could help a friend or family member get the early treatment they need. Don't forget to get your free copy of my comprehensive book about diabetic foot ulcers at www.footulcerbook.com. And if you're experiencing any of the warning signs we discussed today, don't wait. Contact our office immediately for an evaluation. The link to request an appointment is in the description below. Remember, when it comes to diabetic foot ulcers, what you can't see can hurt you. Professional assessment and monitoring are essential for preventing serious complications. Thanks so much for watching today's video. Make sure to subscribe and hit that notification bell so you won't miss the next video in our series. We'll see you next time, and remember, your feet carry you through life, so take good care of them. Thanks so much for watching, and have a great day.